Coronavirus infections are skyrocketing in more than half of the U.S. Officials believe the Delta variant, along with vaccine resistance, are causing the spike. The CDC says the shots offer, quote, significant protection against the more contagious strain. Omar Villafranca has more from Jackson, Mississippi.
Tonight, COVID cases have doubled nationwide in the last week and are rising in 47 states as the dangerous Delta variant spreads across the U.S. The CDC says most of those infections are in people who have not been vaccinated.
We're seeing resurgences now, and we are not seeing that people who are vaccinated are at high risk of infection at this point.
Today's comments come after a meeting between Pfizer representatives and top U.S. health officials on a possible booster shot. Israel has already begun to distribute a third Pfizer dose, but Dr. Anthony Fauci says it is not needed now.
You really do have to examine why you're talking about a booster for a fully vaccinated person when we have so many people in this country who are not vaccinated at all yet.
Just relax.
Less than half the country is fully vaccinated, including Mississippi, which has the lowest vaccination rate in the country.
If someone chooses not to get a vaccine, what decision are they making?
To get COVID.
Plain and simple. No vaccine, you're accepting you're going to get COVID.
Yeah, I mean, that's really where we are.
Hospitalizations in Mississippi have more than doubled since the beginning of July, including 12 children in the ICU. 10 of them on ventilators. 85% of all new cases are linked to the Delta variant. Now, the state is sending vans to reach everyone who wants a vaccine, like 67-year-old Kelvin Smith.
What made you want to do it now, finally?
Well, it's getting bad.
The shot here comes with a pep talk from the clinic's operations director.
Well, you're doing the right thing, because I'm telling you, this Delta variant is no joke.
Of the 12 children, 4 are being treated at the hospital behind me. 2 are on ventilators. Dr. Bryan says the state is also facing another health concern, worn-out healthcare workers who are bracing for another surge. Elaine?
Omar Villafranca, thank you. Dr. Julie Morita joins me now. She's the Executive Vice President of the Robert Wood Johnson Foundation and a former member of the Biden administration's Transition Advisory Board. Dr. Morita, thanks very much for joining us. As we just saw, the Delta variant is spreading fast, fueling a 50% increase in cases in more than half the country. Is this the tip of the iceberg for the U.S., and how dangerous is it for young kids?
What we've seen with the pandemic over the course of the past year and a half is that there are variants that emerge and the virus does change. And what this Delta variant is much more transmissible. And so we are seeing increasing cases throughout the United States. I think it's critical for us to keep in mind that vaccination has prevented most people from getting sick. Those people who are getting sick now are predominantly unvaccinated. And so as we have a vaccine available for children that are 12 and older, those children that are 12 and older should definitely get vaccinated. And then for younger children, we're hoping to have a vaccine that's licensed or approved by the FDA available this fall, and it'll be critical for children to get vaccinated as well.
Well, in 5 states, less than half of the eligible population has received at least 1 dose of a coronavirus vaccine. What are your biggest concerns, doctor, about vaccine resistance?
I think what we've seen play out with this virus is that there are certain people who are more likely to get seriously ill, to get hospitalized, and to die. And it's people who have underlying health conditions and the elderly. And in states where less than half of the population is vaccinated, a good portion of those people who are unvaccinated have underlying health conditions, may be elderly, may be more likely to get sick and hospitalized and to die. And so it's really critical for them to go out and get vaccinated, because now it's not too late to get vaccinated, and it's a critical step that can help prevent people from getting seriously sick.
Well, the White House is teaming up with pop star Olivia Rodrigo to help boost vaccinations in young Americans. Why do you think uptake has been slow for this group?
It's been interesting to watch with the virus that as the disease rates go down, people's anxiety and concern about the disease and maybe interest in getting vaccinated also cannot be as high. But as we see these numbers going up higher and higher, and the Delta virus becoming more predominant, I think that could serve as motivation for young people to get vaccinated and for other people who have hesitations as well. It's critical, though, that we really get out into the communities and understand and talk to those people who are choosing not to get vaccinated, to understand why they're not getting vaccinated. And if it's that they're actually choosing not to get vaccinated, there are still some people who may not have access to the vaccine. So making sure the vaccines remain easily accessible, available after hours, on weekends, those kinds of things are critical. And also working with people who have questions and concerns about the vaccine so they can become comfortable and feel safe getting the vaccinations.
Well, in France, a record number of people signed up for vaccine appointments Monday after the country tightened its COVID rules. It's requiring vaccines for healthcare workers and special passes for stores, restaurants, hospitals, and public transit. Doctor, do you think the U.S. could benefit from a strategy like that?
With our other routinely recommended vaccines, whether they're childhood vaccines or whether it's influenza vaccine, we will implement school requirements or workplace requirements. And so they are tools that can be quite useful in terms of incentivizing people to get vaccinated. I also think, though, before we go down that road of requiring vaccines, it's really critical that information is shared so that people have all their questions answered. And also the vaccines as accessible as possible, that it remains free of charge to people, that the vaccines are easily accessible with walk-in appointments in a broad range of settings, so in pharmacies or in doctor offices or in mass vaccination clinics. Having them as accessible as possible really helps increase the likelihood that people can take advantage of the vaccines. And addressing people's concerns can help them to get vaccinated as well, so the vaccine requirements may not be necessary.
Well, travel is picking up as nations open their borders to tourists, but different countries have approved different vaccines. Could this make people not want to get vaccinated, and how can we address these global discrepancies?
It's interesting to see how it's playing out in different countries in terms of what's being required and what evidence is unnecessary. In some places, like in Chicago, where I'm living right now, they're recommending that people who actually travel from states like Missouri or Arkansas, where the rates are actually high, that they consider getting tested if they've not been vaccinated before they come to the Chicago area. And I think what that reflects is acknowledgement that disease isn't consistently high in all places, and that keeping an eye on how much disease is happening in a particular location or how well vaccinated a population is will really affect what kinds of prevention measures need to be taken. So whether or not masks are necessary or whether or not social distancing is necessary might actually be best determined by how much disease is actually happening in a community, and also how high the vaccination coverage levels are as well.
Finally, Doctor, a CDC panel is meeting next week to discuss vaccine safety, including concerns of Guillain-Barré syndrome. The rare neurological disorder has been reported in about 100 recipients of the Johnson & Johnson vaccine. How troubling are these reports, and what answers are you hoping experts might have?
So the process is being used right now for assessing the association between Guillain-Barré syndrome, which is a muscle weakness problem that it's a weakness in people's muscles. It's really a neurologic problem, but that problem in particular is being monitored carefully and will be evaluated by the CDC panel. This is the routine process that's used for vaccines when a side effect may be related to a vaccine, and understanding whether or not the vaccine is actually the cause of it or whether it's just a coincidence. If it's more likely to be associated with the vaccine or more likely to be related to the disease, it will determine what happens with the vaccine recommendations themselves. It looks like the FDA is moving forward with including it as a warning so people can be aware of a potential side effect, but it'll be critical to see what the CDC panel's evaluation of the safety will show.
All right, Dr. Julie Morita, thank you very much for your time. We really appreciate it.
Thanks for having me.